DW Africa Link.
Declare a state of emergency now. That is the call by the Diabetes Association of Nigeria to the federal government because of what it says is an alarming rise in diabetes-related cases and deaths. Nigeria currently stands as the third African country with the highest prevalence of diabetes. As the world marks Diabetes Day, we are asking if the most populous African country can turn the tide against this silent killer.
My grandma from my mom's side used to have diabetes, and it was third level diabetes, so she died from it. She could not control her urine, she could not do so many things.
And that's what's coming up. Please stay tuned. I am Ajuatin Krama Domina, and you're welcome to Africa Link, the podcast connecting you to the stories that matter.
Africa Link, every weekday here on DW.
Imagine that the number of diabetes cases in your country alone is 9 times higher than the population of another country. That is the story of Nigeria, where 11 million Nigerians are living with diabetes. This not only affects the individuals, but also their families, communities, and the nation's healthcare system. Compared to the country's population of over 230 million people, the number of Nigerians with diabetes is higher than the Seychelles population. The Diabetes Association of Nigeria warns that this figure could be more than double, as many cases remain undiagnosed. The World Health Organization has projected that in 5 years, by 2030, diabetes will be the 7th leading cause of death globally. What can Nigeria and the rest of the world do to escape this looming health crisis? Joining me for more on this is Professor Ejiofor Ugu. He's the president of the Diabetes Association of Nigeria. We also have DW correspondent in Nigeria, Olisa Chukuma. Both of you.
Thank you very much. I am delighted to be here.
Great. Now let me begin with you, Prof. Why are you calling for a state of emergency for a disease that is non-communicable?
Thank you. It's because we have seen clear evidence that if that is not done at the moment, Nigeria could implode from the scourge of diabetes mellitus and other non-communicable diseases. In fact, I like the word used to describe it, that is a looming crisis. It's now more than a crisis, it's an epidemic. It is catastrophic. I don't know what else, how to describe the current state of diabetes in Nigeria. You already rightly say that currently about 11.2 million people are living with diabetes in this country. This represents only the patients who have been diagnosed. And that is less than half of the people who are living with diabetes in Nigeria, meaning that at least another 11 point something million people may have diabetes in Nigeria, but they have not been discovered. So that is a very, very huge burden of diabetes. Another problem is that most of the people who have been diagnosed to have diabetes are not on treatment. They are not on medications. Not because they want to die, not because they don't want to live, but because they cannot afford care. Some of them don't have access to affordable care. So it is estimated that only about a third of patients living with diabetes in Nigeria are on treatment. Now, to make matters worse, out of that 1/3 that are on treatment, only about 1/3 are actually being managed. And this has translated to increase in diabetes-related complications and death. And that is why we are calling the federal government to do something urgently.
Right. What are you anticipating that this state of emergency would do?
Very good. Now, when we say declare a state of emergency, we mean the federal government should put machinery in place, call on all the relevant stakeholders in non-communicable disease sector, and then constitute a committee that will be called Diabetes, Strategic Planning Committee for the country to formulate policies that will halt the current trend, the current trajectory. And what are the things that we expect this company to do? Number one, we advocate that the federal government should, as a matter of urgency, subsidize diabetes medications, especially the essential ones, the common ones. There are some that, almost every patient with diabetes will have to be on. All right. So those few ones can be subsidized by the government to make it affordable to the teeming population of Nigerians living with diabetes. Secondly, there is an urgent need for Nigerian government to consider a tax waiver on importation of essential diabetes medications to reduce the landing costs of these drugs. And of course, that will translate to better affordability to the patients. These things can be done as urgent as possible. And again, you know that the current national health insurance coverage in this country is still very poor, and the rural areas are not well covered. Now, it's important for us to know that most of the diabetes medications and, in fact, consumables like blood glucose testing meters and strips are not currently covered under the National Health Insurance Scheme. So the federal government should consider it as a matter of urgency. And I believe that if these three factors are put in place, it will help to save the lives of those who are currently diagnosed to have diabetes, because they will have increased access to care, affordable care. And of course, we now discuss how to prevent the future occurrence of diabetes in the country. That's how to reduce the prevalence. That is preventive care.
Right. Thank you so much, Prof. Let me come to you, Olisa. For the ordinary Nigerians, what is the level of awareness in terms of diabetes, the rate of increase in disease prevalence in the country? What really is the general public's perception about this?
Well, in terms of awareness, I would say it's not very high. There are lots of factors that really hinge on the awareness of this issue of diabetes in Nigeria. I would say between mid to low level of awareness, generally people know about it, especially when it comes to type 2 diabetes, because that's the most common. But it also depends on the location, like, urban areas to rural communities. Urban areas will have a general awareness about it, but maybe not totally the risks, while some rural areas might not know anything about it, not to talk of type 2 diabetes. But several factors, like I said, contribute to this level of awareness, particularly our healthcare system, which it has to be said, isn't the most adequate. So with that problem of the healthcare system not really being very comprehensive, it then dovetails down into the hospitals, the medical centers, the local healthcare communities where, access to screenings, even things like affordability of, so these are things that just make people just move on with their lives and not bother about awareness about diabetes, unless when it becomes a crisis, so to speak.
Let me go back to Prof. In terms of who is at risk of diabetes, what can you tell us?
I would say that everyone is at risk of developing diabetes. As long as you have a risk of developing diabetes. But there are other people, a group of people that are at a higher risk. And these include people who are getting older. The older you are, the more likely, as the higher ability that you could develop any of the non-communicable diseases. The second risk factor is the family history. If you have got someone who has diabetes in your first degree relative, either your parents, your siblings, your children, then that also increases your risk of getting diabetes. Then another risk factor is unhealthy diet. The first two I mentioned are actually non-modifiable. There's nothing you can do about it. You can't change your age. You can't change your genes. So the reversible risk factors for developing diabetes include unhealthy diet, which so many people are now very, very guilty of. It has become the norm. We have embraced Westernization. If you check our meals, they are mostly unhealthy. Then the other risk factor include lack of adequate facility, what we call sedentary living. And that is why one of the sub-team of this year's World Diabetes Day celebration is actually focusing on diabetes in the workplace, because most of us now, our work now predisposes us to developing diabetes. We can expand on that later. So physical inactivity, poor exercise, the lack of adequate exercise is a risk factor for developing diabetes. And of course, obesity or overweight is one of the greatest drivers of the diabetes epidemic all over the world right now. And our fear is that our children are becoming more obese. And in fact, we're going to have a large population of obese adults in the near future because childhood obesity is on increase because of some of these factors that I mentioned. So, and this will increase the prevalence of diabetes in this country exponentially. So, but the reason why I say that anybody can get diabetes is that if you don't have a family history of diabetes, but you have other risk factors, you could also develop diabetes. All right. So if you are also young, you are not getting older, but you embrace unhealthy diet and all that, you can also get diabetes. So the most important thing is for everybody to check all these risk factors with a view to preventing development of diabetes mellitus.
Right. But how are people able to identify that this is, for instance, a normal blood glucose or sugar level, and at this level, I should start becoming alarmed?
What is routine screening. There are standardized, internationally agreed diagnostic criteria for diabetes. So, and that's why we advocate that screening should be done in a healthcare under the supervision of a qualified, trained healthcare expert to be able to interpret the blood glucose readings correctly and then make accurate diagnosis of diabetes, because so many people are also misdiagnosed. I have seen so many cases, people have been referred to me that they got diabetes, and after thorough evaluation, I ask them to go home that they don't have diabetes. And of course, some people are also moving about with diabetes without believing, without knowing that they have it. So the main thing is to just undertake routine screening of blood, glucose, routine checks. What is advocated by the International Diabetes Federation and also the Diabetes Association of Nigeria is that every adult, anybody who has got to the age of 40 years and above, should have an annual medical checkup that includes diabetes screening. And if the result is normal, it can be repeated every year. But if it's abnormal, if it belongs to what we call pre-diabetes, which is the first stage, so the person can repeat it maybe twice in a year. But if you have risk factors, maybe you have family history of diabetes, or you are obese, or you've had previous gestational diabetes, other risk factors, then you don't have to wait until you are age 40. Screening should start from the age of 18. All right. So once this thing is done, it will be easier to pick up diabetes very, very early and prevent long-term complications.
I'm glad you have mentioned the issue of screening. So I'll just go to Olisa to ask about how easy or difficult is it for ordinary citizens to get screened for diabetes?
Well, generally, when it comes to citizens in the country, it is quite challenging. There are quite a bit of barriers, related to everything has to go down cost, and available professionals and location of where the people are to get screened in the first place, particularly rural areas. In urban centers, there's a bit of more accessibility for them to get screened for diabetes specifically. But the effectiveness of this all boils down to the affordability, especially when it comes to, okay, after you screen, what about treatment, long-term treatment and managing the condition? That's the big challenge, because the average Nigerian is thinking about the financial strain and the financial cost, first of all. So screening is access, but it's very challenged by the factors of, location.
Now, Prof, he has mentioned some of the difficulties that the ordinary citizens have to go through, to get screened for diabetes. And I also remember that this is one of the issues you raised for which you think that a lot of diabetes cases go undetected. How do we solve this?
Thank you very much. I totally agree with Olisa that there are barriers to effective screening of diabetes in this country. Now, in solving this problem, we have to start with orientation. People need to understand that you don't have to wait until you are sick before you go to the hospital for medical checkup. You understand? So overseas, in developed countries, if people do these things annually, either as part of their birthdays or maybe required by their employers. But in this country, you discover that people don't go to the hospital unless they are sick. So we need to continue to create this awareness, to continue to reorientate the population that everyone needs to go to the hospital once in a while to go and undertake screening. So that is one of the ways to solve it. The other thing is we have some unhealthy religious beliefs in this country. Oftentimes you ask people to go and screen for sickness, they tell you that it's not their portion. They tell you that, God is planning good health for them and, nothing will happen to them, children of God and the rest of them. So because this is the kind of thing our religious leaders drum into the ears of everyone on a daily basis, that God is there to prevent us from developing sicknesses and treat our sickness and all that. So it creates a big barrier. So many people find it difficult to just go and check whether they are sick. All right. So we also need to carry out these. They are doing a good job in terms of, getting people, increase their spirituality. But some of the things that they preach are also not good for their health. Another thing, just like Ulisa said, is making screening very, very affordable. You see, before now, I was talking about the increase in the cost of diabetes care. As of 3-4 years ago, a pack of glucose testing strips was just about 2,500 naira. But right now is about 15,000, 17,000. So that has reduced the number of people, presenting to your hospital for screening because the screening tests have become much more expensive. To check blood glucose right now is about 1,000 naira in most centers.
Right.
Something that used to be for 100 naira. So this thing needs to be looked at.
Olisa, let me ask you, you've been speaking to some Nigerians. What are the stories you're hearing, particularly related to late diagnosis of diabetes?
Yeah, well, there are lots of grim stories. You speak to Nigerians and, some will tell you, oh, we know about it. I've not had it myself, but I know of a cousin or a sister or an auntie who had diabetes and it led to severe, ailments, sometimes death or even, amputation of certain limbs. So those are the extreme cases you get to hear, you get to see. When you speak with Nigerians, some also call for more awareness about it, especially when it comes to urban centers. They will tell you, oh, we live in the urban places like Lagos, Abuja, Port Harcourt, but we don't see much about it. We only have to hear it when somebody they know has been hospitalized and they hear for weeks and they hear the person has died as a result of diabetes. So that's the kind of thing you hear. Even I myself, a couple of years ago, I had a brother-in-law who was in the hospital for a diabetes crisis. He had not been taking his medications, and that really puts the family under strain. He's okay now, but that was, how severe things can really get, where 1 minute somebody you think is hale and hearty, the next minute the person is in the hospital for 3 weeks, and and anything can happen from there. So when you speak to Nigerians, these are the kind of stories you hear about. When you go to rural areas, some people don't even know what diabetes is in the first place.
That's very serious. Since the Diabetes Association called for a state of emergency, have you seen any efforts by the government, maybe want to engage them or, just respond to it or talk about intentions they're going to roll out, to tackle the high diabetes prevalence in the country?
Well, we're here waiting for the government to, the response from this call from the Diabetes Association in declaring it like an emergency because people have it. We know that earlier, sometime, some months ago, the government announced an insulin production deal that they had struck with a Chinese company to build what they call Africa's first insulin production plant. The target is for them to reduce the dependence of importation of insulin, which is like a critical drug treatment for people with diabetes. So that's one of the major steps that we've seen so far from the federal government. How that will go forward is still yet to be seen. We know there's a challenge of importation of drugs. The cost of drugs in Nigeria generally has gone high, especially since the removal of subsidy and economic hardship and cost of living crisis. So you can imagine how the cost of insulin is. So for the government, maybe having this deal with Chinese companies to build a factory that can make insulin production and reduce the cost, maybe it will go in some way, to alleviate the pains of the populace who are suffering from this disease in the country.
Finally, for you, Olisa, before I go back to Prof, usually World Diabetes Day, you see the Ministry of Health, organize some programs. How is it looking like for the 2025 edition?
It's still the same, because that's where you get to have the awareness. In places like Lagos, there are planned health works and healthy walks of kilometers from different NGOs to commemorate diabetes. There's a collaboration with the Lagos mainland local government area to create an awareness about diabetes within these mainland communities inside Lagos. It involves also not just the health walks, but also health talks on diabetes with experts and Q&A sessions, along with what they termed free screening for about 500 persons for diabetes.
Thank you very much. Let me come back to you, Prof. For you, do you have any timelines within which you want the government to respond to this state of emergency?
Thank you very much. Our desire is that this advocacy message should get to the federal government immediately. Anybody who knows how to get the federal government to have a listening ear to this advocacy is very, very important, because it will be a lifesaver for Nigerians. It will prevent these premature deaths that we are recording on annual basis. Diabetes is killing about 30 to 40,000 Nigerians every year. That is not a joke. Now, we will be very glad if the federal government can respond 30 days, because it's an emergency. Within 1 month, the federal government can, call a stakeholders meeting, call the Diabetes Association of Nigeria, call the Minister of Health, call the National Planning, the Minister of National Planning and all that, call all the people involved, the Finance Ministry, and let us come together on a round table to form what we advocate as a national diabetes policy and strategic plan. You understand? So we're going to have what we call immediate goals, then intermediate and then long-term goals. For instance, the insulin manufacturing plant contract that Olisa talked about with Chinese, whatever, is a long-term plan. It's not something that is going to materialize within a period of time. And it's not right to allow so many Nigerians dead before the insulin production plant eventually takes off. So there are immediate things that the government need to do. There are intermediate things, and then there are long-term things. So 1 month is a very good workable timeline. Now, how Nigerians can get themselves out of this quagmire of developing diabetes and other NCDs on a regular basis. Yes, that is one of the reasons why we create awareness every time. It's not only during World Diabetes Day. Yeah, just like Ulisa said, a lot of activities are going on all over the country right now, throughout this week and even next week, to create awareness about diabetes. But it's not enough. We do this on a regular basis as Diabetes Association of Nigeria. Now, one of the things we tell Nigerians is please choose healthy diet. Please choose healthy diet. The unhealthy options are everywhere in this country. Avoid as much as possible the intake of refined carbohydrate, highly processed foods. Avoid all these, what we call sugar-sweetened beverages, which is one of the things that we're also advocating. The federal government should increase taxation on sugar-sweetened beverages, which was started by the former administration of President Muhammad Buhari in 2022. All right, they levied 10 naira per liter, or tax on sugar-sweetened beverages. But last year, 2024, this deduction was stopped, and even that 10 naira per liter was just too small, too insignificant to make any impact. So we're advocating that this thing should be increased to at least 200 naira per liter to discourage Nigerians from drinking, from eating to death or drinking to death.
Thank you so much, Prof. Nigerians, please use your legs. Not just Nigerians, but in every part of the world where diabetes is becoming a problem. Professor Ejiofor Ugu, President of the Diabetes Association of Nigeria. Thank you so much for speaking with us. We also had Olisa Chukwuma. He's DW correspondent in Nigeria. We're grateful that you both could join us. As the world marks this day, we hit the streets in Nigeria to find out what the awareness on diabetes is.
So I'm aware of diabetics, what it means, but not like a first-hand experience. Maybe like it happened to somebody that I know, or maybe somebody around me. I've not had to experience it that way. I
want to also believe that they need more awareness. So they need to still go out, just like the way they do World Polio Day. So I think diabetes too, they should also do that the same day, the same thing for diabetes. So more awareness.
My grandma from my mom's side used to have diabetes, and it was third level diabetes. So she died from it, and it was a very crazy experience because she could not control her urine. She could not do so many things. Like, all her muscles were shutting down, and we already knew that at some point she wouldn't be with us again. So we had to brace ourselves. It's something that I feel a lot of people can curb.
It is not called the silent killer for nothing. Diabetes can go undetected for years without obvious symptoms. And when it is discovered, it may have already caused serious complications. So today, find a health facility, check your diabetes status, and stay healthy. You can share your thoughts with us on Facebook on DW Africa, listen on Spotify or wherever you get your podcast, and subscribe to our DW Africa YouTube channel so you never miss an episode. This show was co-produced and edited by Isaac Mugabe. I am Ajua Tinkrama Domina. Thanks for listening.
DW, made for minds.